Okay, well, good afternoon, everybody. I am joined today here, as always, by Dr. Morrison and Minister Bloyce Thompson, the Minister for Justice and Public Safety. Today, as always, during the briefing, Dr. Morrison will update Islanders as to the current state of COVID-19 cases and the other efforts we are undertaking to contain and mitigate the spread of the virus in our province. As we have been saying for the past few days, P.E.I. has been doing a really good job when it comes to how we've moved quickly when required to implement the measures we need to strengthen our provincial response. Under the leadership of Dr. Morrison and so many others, we have heard that we need to expand our areas of focus and attention to those of greatest concern, those with the greatest potential impact to Islanders. Some of those areas being the need to strengthen the measures to protect our frontline healthcare workers and our more vulnerable populations, such as those living in long-term and community care. In addition, an area of focus continues to be the points of entry to our province. Dr. Morrison has talked at length for a number of days now on the reality that a great potential area of worry are those traveling from out of province to return home to P.E.I. And as we know, all of the cases to date in P.E.I. have been travel-related. To date, we have had screening efforts at our points of entry in place, a combination of public health officials and highway safety officials, and they have done a great job. We've also implemented a daily contact effort that Dr. Morrison has called Operation Isolation and was written up glowingly yesterday in the Globe and Mail, where we are in touch with those coming to P.E.I. who are self-isolating for 14 days to ensure they are adhering to the public health directives and that they have all the necessary supports throughout their isolation periods. And these officials have done an incredible job. With the release of our modeling this week, we are certain that screening measures at our borders will need to remain in place for the foreseeable future. In order to share the workload and to put more resources at our provincial borders, Minister Thompson has requested that we enact a state of emergency so that law enforcement officials and others, as designated by the minister in collaboration with Dr. Morrison in her office, can assist with the screening and enforcement of the existing public health orders. We are currently in a state of public health emergency. That will continue. Dr. Morrison will continue to lead our provincial response on all fronts. She has shown strong, confident leadership through these past few weeks, and this is a measure that is a request from her and her office to provide more resources where it has been identified they are needed. The state of emergency allows for the deployment of resources when and where needed and aids our provincial response to this pandemic, and as it possesses a threat to the health, safety, and welfare of people in Prince Edward Island. In addition, as Dr. Morrison will outline, we have expanded our testing capacity over the past 4 weeks to the point where we're in a position to test more and more Islanders today, and that will continue to expand in the days and the weeks ahead. Not only are these efforts consistent with many of our Canadian provincial and territorial colleagues, in many regards we have and we continue to lead the way with our aggressive response to COVID-19 in this province. And just as a note before I pass it over to Minister Thompson, as Islanders, we all know that it is not in our nature to be turning around people wanting to visit our province at any of our points of entry. We are known around the world for our hospitality, and that will always be who we are. But for the short term, taking these measures now, we feel will give us the best opportunity to keep Islanders safe and healthy, and will position us to be in the best possible position for an economic turnaround sooner rather than later. And with that, I will pass it on to Minister Thompson to expand upon the state of emergency, and then on to Dr. Morrison for her daily briefing.
Thank you, Premier King, and good afternoon, everyone. On March 16th, the Premier declared a state of public health emergency to provide Dr. Morrison with the authorities she needed to protect Islanders. Our Provincial Public Health Act gives Dr. Morrison a great deal of authority to do what she needs to do. A state of emergency wasn't required. But I, like Premier King and my colleagues, have said many times around our cabinet table, if she needs help, we are here and ready to help. In the last couple of days, there has been more and more questions about travel. What is essential? What is not? How do you control that? What more enforcement can be done? In discussions with Dr. Morrison, we agreed that the best way forward to help protect islanders is to also declare a state of emergency. This is so we can dedicate more resources to support the Chief Public Health Office. So effective tomorrow at 8 a.m. until April 30th at 11:59 p.m., Prince Edward Island will be under a state of emergency as well. I want to be clear. A state of emergency does not replace the public health emergency extended by Cabinet and the Chief Public Health Office. The state of emergency is complementary. It allows the province to mobilize quickly to help Dr. Morrison do her job. That can be pulling together resources efficiently. That can help with enforcement, border controls, and screening. And a state of emergency and the other orders that goes with it, precisely for that, stronger border controls. In discussions with RCMP and the chiefs of local forces, they will be a coordinated approach to help support our peace officers enforce stronger controls at our port of entries. That's the bridge, the airport, and at the ferries. That is also any piece of shoreline, the beach, a wharf, a harbor, and a port. Like Dr. Morrison has said, for those coming to the island, the reason for coming is because it's essential. The Emergency Measures Organization will also play a role in assessing essential and non-essential travel. They'll be receiving and coordinating requests from inbound travelers coming to P.E.I. for reasonable or not. Anyone looking to travel to P.E.I. will have to call and email ahead. The email is publicsafety@gov.pe.ca, and the phone number is 902-894-0385. This is a process that mirrors what is happening in New Brunswick and Nova Scotia. We know that during these challenging times, even more important than ever, to work closely with our neighbors to ensure the safety of islanders and their fellow Maritimers. So again, the state of emergency I am declaring today does not replace the existing public health one. It does not really change the new normal, but it does provide more resources for Dr. Morrison and her team. Right now, we have to do what is needed to protect our island, and we will continue to take Dr. Morrison's advice. I want to add one final thing before turning it over to Dr. Morrison. COVID-19 is something new that has stopped the world in its tracks. But we have to be united in how we get through this, and we will. I don't know one islander that isn't ready to lend a helping hand to their neighbor. So let's show the world what we are made of. Let's show our compassion to one another. Let's make sure we stand together with our island pride. Thank you. Dr. Morrison.
Thank you, Premier, Minister. Good afternoon. Around the world, there are now over 2 million cases of COVID-19 and over 138,000 deaths. In Canada, there have been over 28,000 cases, and now we're over the 1,000 deaths in Canada. Today, there are no new cases to announce in P.E.I. of COVID-19. So Prince Edward Island continues to have 26 cases, 23 of whom are recovered. I feel like we all breathe a collective sense of relief when these results come in. Because I receive a call whenever there's a positive case, every time my phone rings now, my heart speeds up. We also today report 92 negative new tests since yesterday. In terms of the testing referenced earlier, we have good news in that, while last week we may have done up to a maximum of 100 tests locally, going forward we'll be doing 1,000 tests locally a week, and then eventually over the next couple of weeks increasing that number that we do locally. This will allow us to turn around tests in less than 24 hours for most of the tests, and for some tests we can do in 50 minutes. These tests will be done at the QEH and PCH. Today we're also renewing the global public health order. And this really encapsulates the previous orders, and there are two particular changes that I'd like to highlight. One is that there are new restrictions on any healthcare workers who are working in long-term care. They must self-isolate following any travel outside the province. Previously, there had been an exemption for these healthcare workers. The other note under the Global Health Order for Public Health is we have new requirements for temporary foreign workers who are arriving in Prince Edward Island. And the requirement is that all temporary foreign workers must self-isolate at a central location for 14 days before going on to their workplace. The temporary foreign workers will be monitored closely during the self-isolation. And other jurisdictions are also doing this type of requirement for temporary foreign workers, Nova Scotia and British Columbia. And further provisions have been added to the Federal Quarantine Act to accommodate this as well. We continue to get lots of questions about essential and non-essential services in Prince Edward Island, and an updated list of those businesses will be added to the website today. And we continue to have conversations with businesses and organizations across the province to have those conversations about what is essential, what is not, and what can operate in an alternative way. I'd like to highlight a couple that we've had a number of questions on. We've been receiving inquiries about those who are preparing community gardens across the province. And these are areas that provide fresh produce to community members, and it's part of the food production, and I do feel it's important that these continue. So although these are not open for gathering purposes at this time, those who are preparing the gardens and planting are able to go ahead with their work as long as the physical distancing measures are in place and 5 or less people will be there. Golf courses, of course, are another area that requires preparation and maintenance. Although golf courses are not open to the public at this time, those who are preparing and maintaining the courses will continue that work. Again, physical distancing must be practiced during this maintenance. And as we've said before, we will continue to review the measures that have been put in place, and that includes considering amending the start date to the recreational fishing season. And we've certainly heard from a number of recreational fishers. As you know, we have been monitoring people entering P.E.I. for several weeks, and it has been effective. As the Premier mentioned, all our cases thus far have been travel-related. I do feel ongoing screening and follow-up is essential. And so to further strengthen our screening capability, I have asked the province for additional supports in screening capacity and enforcement. And the complementary nature, as Minister Thompson has indicated, of the public health state of emergency as well as the provincial state of emergency will help us continue and to monitor and control and mitigate the spread of COVID-19 in Prince Edward Island. I am so proud of how much we've done and how far we have come, but we are not finished yet. The actions we have taken together have made a difference, and we want to continue to make a difference. And I think Minister Thompson's comments about being united and being compassionate as we do so are really important. Thank you. Okay, juste en français, quelques mots. À travers le pays, il y a plus de 2 millions de cas de COVID-19 et plus de 138 morts. Au Canada, on a dépassé 1000 morts et on est à 28 000 cas. On n'a pas de cas nouveaux ici à l'île du Prince-Édouard aujourd'hui. Nous sommes à 26 cas et 23 sont rétablis. Les insulaires font une belle job et on doit continuer sur la même voie. On a reçu 92 tests négatifs depuis hier et on a des bonnes nouvelles à propos des tests. La semaine passée, on a fait 100 tests maximum ici, dépistage localement. Et dorénavant, nous aurons la capacité de compléter 1000 tests par semaine. Ça va faire en sorte que les résultats seront retournés plus rapidement. Et puis, dans les semaines qui suivent, on va augmenter ce nombre aussi. L'ordre de santé publique globale va être renouvelé aujourd'hui. Il y a deux choses que je veux mentionner. Il y a des restrictions pour les travailleurs de santé dans ces établissements de soins à longue durée. Et lorsqu'ils reviennent de l'extérieur de la province, ils doivent s'isoler pendant les 14 jours. Et l'autre est, il y a des nouvelles restrictions pour les travailleurs étrangers temporaires qui arrivent ici. Eux aussi devront s'isoler pour 14 jours à une place centrale dès leur arrivée. Par la suite, ils iront à leur place de travail. Ils vont devoir, on va les observer et, pendant ces 14 jours, ces 2 semaines. Et ces directives sont disponibles au point d'entrée et ont été distribuées pour les employeurs. Il y aura une mise de jour du site web aujourd'hui pour ce qui est considéré comme des commerces essentiels et non essentiels. Et nous continuons à engager les commerces et les organisations à travers la province pour déterminer ce qui est et ce qui n'est pas essentiel et comment ils pourraient opérer autrement. Je ne vais peut-être pas mentionner tout, mais les terrains de golf, parce qu'on a des questions, s'apprêtent aussi sur la saison. Quoiqu'ils ne sont pas ouverts actuellement, il y a du travail à faire pour les préparer et les maintenir. Vous pouvez y aller le faire, mais retenez l'importance de la distance physique pour ceux qui préparent et vont les maintenir. Merci à chaque insulaire pour le travail qu'ils font pour les uns et les autres pendant cette pandémie. Je suis tellement fière de vous, de ce que nous avons accompli ensemble à date. Mais nous sommes loin de finir. Mais on est capable, ça va bien aller. Merci.
Thank you, Dr. Morrison and Minister. I think with that, we will turn it over to the esteemed members of our media to ask some questions. So, open the floor.
Nicole Williams, CBC.
Hi, my first question is for Dr. Morrison. You mentioned asking for strengthened screening measures. What does that mean exactly?
So the measures in terms of what kinds of questions will be asked at our points of entry will continue, making sure people have a plan for self-isolation and the supports necessary to do so. That part will not change. I think as we look ahead for the possibility of the Northumberland ferries, for instance, we certainly needed more capacity, and I think that was a big part of the strengthening from our point of view, because our highway safety officers and our public health officials who've been at the bridge have been doing a really incredible job. They do shifts day and night, and so we really appreciate that. But there's only so many of them, and I think we needed some assistance, particularly in our numbers of people who are able to do that. And so in terms of the types of questions, that won't change as much as needing some human power enforcement.
So just to clarify, that means police will be involved in these screening measures at the borders.
Well, Well, potentially, but not necessarily. I think the act, as the minister has spelled out, would allow the minister or in coordination with EMO officials and Dr. Morrison to essentially, I don't know, Bloyce, if deputize is the right word, but to put people in place. So in some regards, it could be our enforcement agencies for sure. In many regards, it will continue to be highway safety. It will continue to be the public health officials who will do some of the health screening. But it will give us the opportunity to bring in more people to give them the authority to do what they need to do.
Thank you. And can you just be specific about exactly what's changed at border crossings in terms of what people have to do to get on P.E.I? Like, do they have to email ahead of time before they arrive? What do they need to do there?
I will take the first part of that. So we've been asking people to contact our office either by email or by phone to outline what they need to get here. For the last number of weeks, we have asked people who are not island residents not to come, and that's consistent with what other provinces are doing. The Prime Minister has asked people, don't go to cottage country right now. It's not the time for that. Our borders remain open to those islanders who are coming home or are island residents, but we continue to ask and will be continuing to turn back those who aren't island residents with their proof of residence that don't need to be here right now, that we're asking them, and I say this goes against our nature of who we are as islanders, but for the time being, we need to err on the side of safety of those islanders that are here. So we will continue to ask the questions, as Dr. Morrison has said, asking why you're here, what is your support systems, and all of those things. But we are essentially saying that essential traffic only at our points of entry.
Louise Martin, CBC.
Hi there. So my question is about essential workers. Dr. Morrison, you mentioned that long-term care workers must now self-isolate for 2 weeks. I wonder if that will change your guidance for other essential workers coming to the province. As I understand it, they're asked to self-isolate when they're not working, so kind of in and out of self-isolation. So will this guidance change for all essential workers here?
Well, I think at this, first of all, hi, Louise. So I think this was included because of certainly the risk to the vulnerable in the long-term care facilities, and that sort of being the highest point. So I think certainly we'll look at other essential workers, but that was certainly a priority to when we had we're opening up the order to amend it at this point in time. Certainly, for instance, truckers that are coming in and out, they may come back, self-isolate when they're here, but they may need to get back and take supplies and go get supplies, so that would be something that would be different. So it will be, we'll continue to look at it and assess where the risk may be.
Thank you. And my follow-up is, are you tracking the number and or movements of essential workers coming into Prince Edward Island?
So they're given the same information about what self-isolation means, understanding that they're also may need to return to work. And we have, I know, I mentioned the truckers before, and there's been discussion about the trucking industry previously. Some of the truckers are actually even staying in motels and accommodation so that they self-isolate away from vulnerable people in their family, for instance. So it's we're I guess we're not putting any device on them to track them, but I think they are getting the information about self-isolation similar to everybody else coming into the province.
Thank you.
You're welcome.
Rachel Collier, The Eastern Graphic.
Hi, can you explain a little bit more about why golf course workers would be considered essential?
Well, it's really the preparation and the maintenance of or getting the golf courses ready, and I think it's a hopeful sign that we have a lot of people who like to golf in this province, and that it's important that process starts, and they can't leave that work to be done until the summer. So, and that is our understanding, and that a lot of that maintenance or getting golf courses prepared is not done in big groups, and they are able to do so maintaining social or physical distancing. And so that was what was considered in that. And there's quite a long list of essential and non-essential, but what that means and how you can operate. So that was just one that we're getting questions on so many, but that was there were those couple that I highlighted today.
Okay, and I guess so for now, would construction workers, they would be considered essential, but with what you've just said, they will have to self-isolate for 14 days once they arrive on the island before starting work, or?
So I think we weren't speaking about construction workers. So the people who are arriving on Prince Edward Island, if they are essential workers, they do self-isolate for 14 days. If you are an essential worker who may be I keep using trucking, but in the trucking industry, or working that for the maintenance of our critical infrastructure, or they would self-isolate when they're not having to be at work or when they return to work. The change today is around the essential workers, of course, which are healthcare workers that are included in that category, and the essential healthcare workers who work in long-term care, and that's a key difference. But that is really an area that, of course, I know you've been watching what's been going on around the country, a real critical area that we want to be very careful about, and so we want to make sure that the essential healthcare workers who work in long-term care will self-isolate when they come. So it does not apply to all essential workers.
Okay, thank you.
You're welcome.
The Guardian.
Hi, good afternoon, everyone. Question for Minister Thompson. My reading of the legislation, the difference between public health emergency and a state of emergency is state of emergency seems to be more explicit around giving you the ability to control or prohibit travel. So I guess my question is, I mean, if we've been restricting travel around the Confederation Bridge for a few weeks now and have turned away travelers, why now? Why enact a state of emergency now? Has there been any kind of legal challenge to any prohibitions of travel up to this point?
No, there hasn't been, Stu, and thanks for the question. And it's just more around the resources available for Dr. Morrison, as she pointed out, possibility of the Northumberland Ferry opening, the warmer weather coming with more wharfs and harbors starting to open up. Her resources are being stretched to the limit, and it's a crucial couple of weeks we have, as Dr. Morrison has pointed out. So this just gives her the extra resources she can use and to help control their borders. Heather has something to add to that.
Oh, sure.
Stuart, hi. I was just going to add that just for clarity, officially under the Public Health Act, public health officials include our environmental health officers and Dr. Sabapathy, the Deputy Chief Public Health Officer, and myself. So, and I don't think I can do any shifts at the bridge at the moment, and so I mean, really, it truly, I mean, it was our ability in terms of numbers has been stretched.
Okay. Well, I guess a follow-up then, Dr. Morrison, on some of the things you'd mentioned about testing. So you mentioned that, I guess, capacity is now increasing. I gather you said that there was a goal of getting up to 1,000 tests per week. So what's changed, I guess, since yesterday? I think yesterday we talked about having the capacity to do 200. Has there been any new machinery purchased, or does this have anything to do with the Lumen Ultra providing reagents to the Public Health Agency of Canada? What's different from yesterday?
Well, Stu, thank you. And I know there was some clarification provided to you after the briefing yesterday afternoon, so I know you have that. So it's actually just we had a new this is what we've been talking about again over the last couple of weeks. And so a new machine, it's called a BD Max, and I think you were sent that information. And once it was validated and initial testing done on it, then it is ready to increase our capacity locally. So of the 92 negatives that are reported today, more than half of those negatives are actually reported from locally, and then the other half from our lab in Halifax. So, and then going forward, we will be able to certainly do much larger number, as I mentioned, certainly up to 1,000 tests per week here, and over the next couple of weeks, and then we're hoping to even double that in the weeks after that. So I really think that's good news. So it's actually not anything remarkably new. It's really just a continuation of what we've been speaking about over the last couple of weeks.
Okay, thank you.
Ocean 100.
Good afternoon, all. Dr. Morrison, just with that local testing being augmented that much, so how will it expand for people? Like, are we just going to maybe test more people that only had mild symptoms? Are we going to expand the parameters of symptoms, that could be tested? Or how will that work?
Well, so hi, Carrie Wynn. The testing criteria, and we've talked about it here previously as well, that expanded a couple of weeks ago so that people, even with mild symptoms, with or without travel, are able to be tested at our clinics that are set up, and we're going to absolutely continue to do that and encourage people to be tested. And that's not just cough or fever, but if you have new and unusual fatigue, weakness, chills, sore throat, runny nose, certainly a variety of symptoms. And I think it's really important because as we go forward with doing measures at our points of entry, it's really also important to be doing increased testing here. So it's that continuing what we're doing, but also, and I think you raise a really good point, we're in discussions about what else that could mean as we go forward in terms of expanding our testing. So is that making sure that people who are being admitted to long-term care get tested on admission, and then get repeat tests if it's negative the first time. We are having conversations about what else can we do and what are the big risk areas that we want to make sure we identify. So we had a discussion last night, and we'll continue to have those discussions as we go forward. And certainly I feel like we're really fortunate to be in a position where we can have that conversation and have that capacity to do so locally.
Thanks. My next question would be for the Premier or for Minister Thompson. Dr. Morrison mentioned about some changes there for the temporary foreign workers, that they have to self-isolate for 14 days at a central location. So all of them together. Can you give me a picture of what that looks like? Where would these central locations be? Who's responsible for setting that up? The cost, the organization of it all?
Well, I can take the first part of that, Carrie Wynn. We would be securing hotel accommodations for the temporary foreign workers. When they arrive in P.E.I, they will be transported to that location, and they will be isolated for 14 days. I think in the days ahead, we will announce where those locations are. We have been in consultation through a various number of departments with those companies and P.E.I. who are bringing in temporary foreign workers. They are fully supportive of what we're doing. The federal government has allocated money to pay for this. So the conversations that we have had at the level with the Prime Minister, and I will be bringing it up again tonight on our First Minister's call, that money, we will pay for the hotel and we will be reimbursed by the federal government.
Laurent Lavoie.
Yes, I have a question for Minister Thompson. I'm just wondering about the fact that people now have to call or write before they come to P.E.I. I mean, how many days in advance do they have to do that? How does it work exactly?
Well, the turnaround will be very quickly. So this just gives the person arriving at the bridge an opportunity ahead of time to know if the opportunity exists to get across, for one thing. And this is just to make it more transparent and everyone be ready. So this is a quick turnaround, but it gives everybody more heads up.
So just to be clear, is it mandatory to call or to write to come to P.E.I., or you can still come without having checked before?
You can still come, but we're requesting that you call ahead. It'll make everyone's. We're in difficult times here, so we want to make everyone's life as easy as we can. So this is a recommendation.
Okay, and just to follow up on that, it applies also to the people who come by plane, I assume. So there will be, something checked, for instance, at Montreal before coming to the plane. People will be asked if they called before.
That's a good question. Dr. Morrison, do you want to take that one?
I know this question has come up before in the last number of weeks, trying to alert the airlines because we only have a few flights coming in now to Charlottetown, trying to alert the airlines that they will be screened on arrival here, not only when they come into the country if they're coming in internationally, but they will be screened here on arrival. We're trying to get that message out, but they will still at the airports be asked the same types of questions. We are certainly have received a large number of emails about people having questions already if they're arriving by airplane or by vehicle, and I anticipate that will continue. But it will help us again have one number to coordinate that response to people, and I think it will have some clear questions and criteria going forward as well.
And it's important to also continue to point out that we've been consistent for the last couple of weeks in this regard, and that is, if you're not an island resident, we're asking you not to come here right now. And that also pains us as islanders. As I continue to say, we don't want to be in this position, but because we're in this position right now, if you're not an island resident and if you're not an essential worker, we're asking you not to come to Prince Edward Island, and that is consistent with what other jurisdictions across the country are telling their travelers as well.
Thank you.
François, Radio-Canada.
Bonjour, Dr. Morrison. L'état d'urgence, en plus de l'état d'urgence sanitaire, qu'est-ce que ça vous apporte de plus dans le contrôle de la COVID-19? Vous avez mentionné en anglais tout à l'heure que vous manquiez de ressources pour contrôler le pont de la Confédération. Qu'est-ce que ça vous apporte en fait de pouvoir déclarer l'état d'urgence aujourd'hui?
Bonjour. Alors, l'état d'urgence, je pense, va nous aider pour donner des ressources parce qu'on n'a pas assez d'officiaux de santé publique. Et on parle déjà d'ouvrir le traversier de l'île du Prince-Édouard à Nouvelle-Écosse. Et alors, on a seulement un certain nombre d'officiaux de santé publique. Alors, on a besoin un peu d'aide parce que ça continue et on a plusieurs personnes maintenant qu'on a commencé à faire les suivre pour 14 jours après les gens arrivent à l'île du Prince-Édouard. Ça prend beaucoup de temps aussi parce qu'on fait les appels à tout le monde. Alors, on a juste du capacité vraiment que ça va nous aider.
Question sur un sujet un peu différent, Dr. Morrison. Les trousses de dépistage contaminées, on dit qu'il y en a qui sont arrivées de Chine. Le Nouveau-Brunswick en a reçu environ 6 000. Est-ce que nous, ici à l'île du Prince-Édouard, on a reçu des trousses de dépistage de la COVID-19 qui étaient contaminées? Si oui, combien?
Alors, qu'est-ce que je sais à ce moment est qu'on a reçu, c'est pas un grand nombre, mais ils n'étaient pas utilisés, alors ils étaient renvoyés. Alors, mais on a plein d'autres parce qu'on utilise les tests locaux ici. Alors, c'était pas je m'inquiétais pour un moment quand j'ai entendu aussi, mais ce n'était pas quelque chose qui était un problème ici.
Merci.
Okay, merci.
So I think that's the end. I just would close again by thanking Minister Thompson and Dr. Morrison for being here, and also to our friends in the media at a time when Islanders need to stay connected and need to stay informed. I think it's always important to say to all of you, thank you very much for the job you're doing and helping everyone stay informed and connected. So merci and thank you.